Good afternoon, guys. Welcome back to my channel. This is Dr. P. As you know, this is the part two for the treatment of heart attack. So we just finished discussing part one. So don't forget to subscribe to this channel if you want more video on health issues. So in continuation, when somebody have an heart attack, you call 911 and you do CPR so that to keep the person alive until help, medical help arrive. Then we also use, they can also use AED, which is known as automated external defibrillator to bring back the heart into a normal rhythm. So there are many tests to diagnose a heart attack. So we have EKG, then we have the blood tests such as doing troponin and CKMB, that's the creatine kinase. Then you have also the echocardiogram. Then the next one is what we call the cardiac catheterization, whether you have to use a catheter. We call it a cath lab. They were talking of a cath lab. So we have to use a catheter during which is performed during the first few hours of heart attack if the medication are not releasing the symptoms of heart attack or are not relieving the ischemia. So the cardiac cath can provide you a clear image to see the blocked arteries and guide you the choice for which procedure you want to use. You can either use the angioplastic procedure, you can use the stent placement procedure, or you can use a coronary artery bypass surgery. So that's the importance of using a cardiac catheterization. As you all know, in cardiac catheterization, in this procedure, as I said before, a catheter, which is a thin hollow tube, is inserted into the blood vessels in your groin or in your wrist and is threaded up straight to your heart. So a dye is used to highlight your arteries. So, as you know, the doctor who's doing this, or who's going to do the cardiac catheterization, can then be able to identify the blockage, which are used to treat with they can use it to treat in treatment with angioplastic or stent to open up the blocked arteries and restore flow of blood. So they can also use it to do several tests to your heart. They can also use the intravenous blood thinner. It's an option to open up an arteries if a cardiac catheterization is not available. So as you can see, the the doctors can also do what they call the testing, stress testing. This whereby you have to be on a treadmill. That's what called a treadmill test. They can also do a radionuclide scan to check whether other areas of the heart are still at risk for heart attack. So, as you can see, what are the common cardiac procedures? We have a lot. So, the first one is known as angioplastic, whereby a special tubing with an attached deflated balloon is threaded up to the coronary arteries. Then we also have angioplastic laser. But this angioplastic laser is similar to angioplastic, except that the catheter has a laser tip that open up the blocked arteries. Then we also have the artificial heart valve surgery. This is used to replace an abnormal heart or a diseased heart. You replace it with healthy heart. Then we also have what we call arterectomy, whereby you remove the arteries. So it's similar to angioplastic, except that the catheter has a rotating shaver. So the rotating shaver has a rotating shaver on its tip that is used to cut away the plaque from the artery. So it cut away the plaque from the artery. So also we have the bypass surgery, which we all know about. That's used to treat the blocked arteries by creating a new passage of blood flows to your heart muscles. Then you have the cardiomyoplastic. These are experimental procedures in which the skeletal muscles are taken from the patient back or abdomen, so to take care of the disease heart muscles. Then we also have the next one is heart transplant, whereby you remove the diseased heart, you replace it with a healthy heart from a donor healthy heart. Then we also have the minimally invasive heart surgery. This is an alternative standard for a standard bypass surgery. It's an alternative way of using a bypass surgery. So it's minimally invasive. So it's very common nowadays. Then we have the next one is also they can also use the radio frequency ablation. So this in a radio frequency ablation, a catheter with an electrode at its tip is guided through the veins of the heart muscles to destroy the carefully selected heart muscle cells in a very small area. Then the next one we have was most people know this the stent procedure. A stent is a wire mesh tube used to prop open an artery during angioplasty. Then we have the next one, which is known as transmyocardiac revascularization. That's TMRO. In this, a laser is used to drill series of holes from the outside of the heart into the heart pumping chamber. So thank you very much and welcome back. Having listened to this video, this is part 2. So if you want to listen more of this video, you go to the part 3 on the treatment of heart attack. Again, this is Dr. P. So don't forget to subscribe to get more videos. Thank you very much.